for pain relief from a nagging backache can seem like an endless one for many sufferers, but thanks to a special surgical procedure, there is new relief in sight. Please welcome back Dr. Saqib Siddiqui with Surgery Specialty Hospitals of America to fill us in on the latest options. Hello there. One of the points you want to get across is do not live with pain. There are a lot of people who think that's their only option. Technology is changing all the time. You know, there are other therapies that might come into play early on, which it would involve what?
Sure. I mean, obviously you want to always do something like physical therapy, maybe chiropractic treatment, get spinal injections, and try to avoid surgery at all costs. And if that's not working out, then, you know, there's this overriding fear in the public eye of having spinal surgery, that it is this big ordeal, and you're going to be out of work for months and months and be in the hospital for days and days.
Spinal surgery years ago could have been that.
And it was that.
Yeah, but things, of course, have changed. So the key is, instead of just sitting there living in pain or dealing with pain medications, is to come in and at least get an evaluation if the other things are not working.
That's right. You know, and that starts with just a physical exam and getting some x-rays and MRIs and evaluating what is actually the cause of the pain. And you know, we're going to show like 3 different videos, and one of them is actually to do with a new procedure called sacroiliac joint fusion.
Okay, if we can take a look at that video, get that up. All right, and so here we go.
And the sacroiliac joint is a joint between your sacrum and the pelvis, and it's a source of pain that's under-recognized these days. And you can see here some procedure being done. We're setting up for it, and it's basically a minimally invasive procedure. The incision's only about 2 inches long in the side, and we are placing these metallic implants that are placed over guide wires using x-rays.
Yeah, and when you say that big word there was source of pain, because oftentimes back pain can be that mystery and people don't know where that pain is coming from, but once you know where it's coming from, you can better treat it. And minimally invasive, meaning that your recovery time is much better.
Exactly. There's many advantages of minimally invasive surgery. Their blood loss is less, the incisions are smaller, you have less pain afterwards, and because of all those reasons, recovery time is shorter, and you're able to get back to work and daily activities a lot shorter than traditional techniques.
Yeah, all right. You also have a model here, because this is something that obviously most of us...
Yes, this is a model of the pelvis, and you can see here is the sacrum, and here's the sacroiliac joint. You have one on the right, one on the left, and in this model you can actually see the 3 implants that are being placed from the side, as you saw quickly in that video. And these are all put in over a wire, so the total incision length is maybe 2 inches, and the patient's able to walk the same day and leave from the surgery center or hospital the same day.
Because I know, I remember people having back surgeries when I was a kid growing up, and they could be in the bed for like a month.
Yes, and of course other causes of back pain are, you know, from the disc, from the lumbar disc, and people have fusions. Everybody's heard of fusions, and when they hear the word fusion, they think, oh my God, we're going to have this massive surgery, and it doesn't have to be that way. And we have a couple of other videos that show some techniques to do lumbar fusions. One of them is a transsacral fusion, which is the video being shown now. Now, this is done through about a 3-centimeter incision next to the tailbone. And you can see there they're utilizing the space between the rectum and the sacrum and creating a safe channel. And once you've got your guide wires in place, of course, this is all done using x-ray machines in the operating room, so we never directly expose the spine. It's all done by watching the monitor and watching the x-rays. And once we have a safe channel, we drill the tunnel, we take out the discs using the cutting instrument and put in bone graft, all done through about an 8 or 9 millimeter channel.
Yeah.
And once the bone graft is in place, we put a guide wire again, and we place a screw. And you can see the screw here on this model that we'll show you in a second. So the screw is about a 10 millimeter in thickness. You can see it across the across the sacrum and the L5 vertebrae, just anchoring everything in place.
Yeah.
So that's all done through about a little 3-centimeter incision near the tailbone.
That's amazing. Do we have that next graphic or animation also, so we can explain this next procedure?
Yes, the next procedure we're going to talk about is a lateral fusion, where again, instead of going through the front of the stomach or making a huge incision in the back, we are making about a 4 to 5 centimeter incision in the side.
Yeah.
And using nerve monitoring, we're able to bypass all the important nerve plexuses in the lumbar spine and go through the muscle and dock with the spine. So we have a special retractor that we put down, and we're able to use fiber optic lighting down the tunnel and work through a channel and do all our work of the discectomy and placing this cage all through the incision in the side.
I'm glad that you went to medical school and you know how to do this. I think a lot of people, but the end result for the patient is that oftentimes when they thought that they had to live with the pain is that they don't most of the time. And so that's what's great about these surgeries today. And for more information on Dr. Siddiqui and Surgery Specialty Hospitals of America, you can call this number at 713-378-3000, 713-378-3000, or log on to backsurgeryhouston.com. And again, the point he made, the back surgeries that you used to do years past are not the same today. So get up and get moving. Thank you very much.
Thank you.
Well, we know that exercise is a big part of staying healthy, but for some people, lacing up those tennis shoes and taking a jog outside is just not an option. Great Day's Courtney Perna is at a place many area doctors are prescribing as a starting point. Oh, that looks dangerous, Courtney. Back up a little bit from the camera.
I know, this looks like a weapon, Deborah, but it is not, although I think it could be. Coming up, I will introduce you to an exercise class that's using fun, creative ways to get in shape, and everyone's invited.